Welcome to Inside the Digital Health and Sales Locker Room. I am your host, Josh Pappas. And as a reminder, I am the Director of Sales and lead early health system partnerships for Tendo. We're really focused on helping create a more consumer-driven patient experience. And that's why I'm very excited about this episode, welcoming two of what I would consider some of the gurus on the topic of consumer-driven healthcare. For episode 5, I welcome Jared Johnson and Zane Ismail. Jared is an excellent resource, part consultant, part thought leader, and he hosts the Healthcare Rap podcast, and he founded the Shift Health Content Network. And he's always given the industry a new perspective to think about, particularly around consumer-driven healthcare. Zane is the Director of Healthcare Consumerism and Network Experience for Avia. And where Avia, he helps drive Avia's business development and client engagement goals by creating community amongst the network of 57 health systems. And he also helps co-host the Healthcare Rap podcast with Jared. These are two very seasoned individuals, and I look forward to diving into all the different segments and topic around consumer-driven healthcare. Make sure you go ahead and follow their podcast, the Healthcare Rap, as well as Shift Forward Health on wherever you subscribe to podcasts. And make sure to like, review, and subscribe to the newsletter of Inside the Digital Health and Sales Locker Room, wherever you get podcasts. Super excited and enjoy. Welcome to the podcast, Jared and Zane. Looking forward to having a special consumer-driven healthcare episode. So excited to have you guys on the podcast. And I guess we'll go individually. Jared, you'll start, and maybe then Zane. Brief intro for those that don't know you, and would love to hear your origin story of why healthcare and then why consumer healthcare. They're wrapped into that intro.
You want to go first, Jared?
Sure. Yeah. Thanks. Thanks, Josh, for first and foremost for having us on. This is fun. I don't think the two of us have ever been guests on the same show before. So
no, the script is flipping. The podcasters being podcasted to.
That's right. That's right. I like it. Brief origin story is I'm an advocate for consumer-driven healthcare. So redesigning and rebuilding the parts of the healthcare experience that make it easier for consumers. And so that came about as a result of close to 20 years in healthcare, from both the med tech side, medical device side, as well as the provider side, working numerous roles in digital and marketing leadership positions, and seeing how that all sometimes stands in contrast with the business systems underneath healthcare. So I'm passionate about those things. I have experiences in my own life with loved ones that I'm like, man, that's a shame. The system went a certain way and things happened with them. So on top of that, I have a podcast channel called Shift Forward Health, and Zane and I co-host Healthcare Rap, which is our flagship show on that channel.
Absolutely.
Fantastic.
Let's see. I got into origin story on my side. I got into healthcare really by way of hospitality. And so when I was younger, and still am, very interested in like food and service and the art and science of making people feel welcome. I thought I would go work for the Four Seasons at the Ritz-Carlton, but through a series of very fortunate events, I realized that my affinity for service could probably be better applied and frankly higher compensated working in health systems and some of the work that I do today. And so, out of college, ended up working at a think tank at the Ivey Business School in London, Ontario, Canada, where we did a lot of work helping Canadians understand what high-performing health systems look like. From there, jumped into rural healthcare operations and helped a small hospital outside of Windsor, Ontario, reinvent itself. Did a lot of work in behavioral health there, and then eventually came to the U.S. and got recruited to Henry Ford Health System, and then eventually where I'm at today with Avia Health Innovation, working with now a whole group of hospitals across the country to help with their consumer transformation. And so, again, sort of that hospitality and service experience combined with health services, I think made me, a pretty good candidate to do some of the work that I'm doing today. And then, of course, a couple of years ago, Jared crossed my path and joined his podcast. So here we are.
That's fantastic. And then I'm sure you've shared, but what was the genesis of the healthcare rap podcast? I mean, in my mind, I have Jared, out there Eminem style in a rap battle, visiting you at Henry Ford, just rapping about consumer driven healthcare. But I'm sure, the actual story is a little bit different.
That would have been that would have been better.
That's not how we were actually connected through a mutual friend and said, hey, the two of y'all should know each other. And it was really at the height of the pandemic that we connected through Zoom, and to this day have never actually met in person. And so we'll definitely let you know, Josh, when we actually do meet. We have a plan to meet this year. But yeah, that's how it all started.
Right. And the rap part, so the intro to the podcast is a rap. It's about breaking down the silos and focusing on consumers and healthcare. It used to be about like digital and marketing, and now it's all about consumer first health. But it originated in 2018. My original co-host was Peter Balistreri. He and I were colleagues at a hospital, building up their digital and marketing capabilities and having conversations like, hey, well, it's pretty clear one of the best ways for us to market this hospital would be make it easier to schedule an appointment with one of our providers. Let's go see how that's going to work, and getting shot down immediately. To say, yeah, we're not going to do that. We're not ready for that. So just having conversations of like, is it them or is it us? And we just started doing that once a week. And long story short, yeah, that was 5 years ago. But that's where it started, from a hospital-centric perspective, just trying to see like, what can we learn here? What can we do? How can we help things progress? And that year, just a few months before the podcast started, I had been asked to give a keynote at a conference at Johns Hopkins, and I get nervous when I do that. I will just say that, but to kind of calm my nerves, I'm like, I'm just going to come out on stage and introduce myself by rapping and just changing the words to the Fresh Prince of Bel-Air. And so I actually came out with a little thing, and they didn't throw me off stage, so I assume it went okay. But I was like, I'm actually going to try something like that again. That's the full origin story.
And wow, I do not contribute to the raps at all, just to be clear, at all. That is not the contribution I make.
That is fantastic. Well, good, guys. Well, appreciate you having on. The origin story of this one is kind of that intersection of digital health, sales, but super focused in my day-to-day on consumer-driven healthcare. So before we jump in, the 6 topics that we have, segments, if you want to call them, but would love, with the Super Bowl coming up, I'm always interested, what's kind of the most memorable when you think about an event, like you as a consumer, whether that's sports related or not sports related, like what's the most memorable event that you can think about as a consumer? And then I'd love to share mine. Zane, you want to go first?
Most memorable event. Hold on here. You know what? So I don't follow a whole lot of sports, to be honest. So I'm going to talk about an experience I had at a restaurant not too far from up here in Detroit. There's this Italian restaurant called Bacco that when you walk in, these people don't know you from a hole in the wall. Mind you, it's an expensive Italian restaurant. These people literally make you feel like family. And so this whole team of waiter, like your head waiter and then all his henchmen surround your table. The owner of the restaurant comes out and hugs and kisses you as if you were in Italy. And you leave the place, paying an exorbitant amount of money for pasta, but you love these people and you feel like they love you, and we go back all the time. And so when I think about one of the best service experiences, this would have to be it. And I wish health services would feel that way. They don't always do.
It's really true. It's really true. And one thing I will tell you, one reason I always I've enjoyed having Zane co-host with me is tying things back to moments like with restaurants and hospitality and other ways, because that's how most people compare their healthcare experiences anyway. For me on the sports side, so it's more of a moment than an event, but it ties back to my roots growing up in Houston. So who's the team you're going to root for is the Astros. It's hard to even admit that on the air these days, because for those who don't know, and they won the World Series in 2017, the first time ever. It was like the best day of my life when they won. And then in 2020, it was discovered that they had cheated. They had come up with a way to steal signs, and with this elaborate scheme, bang a trash can from the dugout. It was crazy. They got really good at cheating, basically. And ever since then, I almost don't tell anybody that that's who I rooted for. But then this last season, all I wanted was for them to like be competitive after that, because they had a good team. They didn't have to have cheated in my mind that season to win. And so this last season, they ended up winning the World Series again. And I just kind of felt like I was able to exhale a little bit and say, maybe it's okay to admit that I like this team. I'd like to think that maybe that means I'm loyal or open-minded, because it's really hard to root for the bad guys in the sport. I've never had to before. But when they won this last season, I was like, okay, at least they won, hopefully without cheating this time.
That's awesome. Yeah. I think you, and then I guess I read an article where like Mattress Jack, there's some like mattress owner in Houston that laid a big bet on the Astros. So you were happy. And then I think he won like something to the tune of $10 million. So I'm sure Mattress Jack was happy. I think for me, it was probably a moment too. I grew up outside of Chapel Hill, so college sports were super big. And although I'm like the weird kid that doesn't like Duke or Carolina, back in the day, but I had the great experience to go to a Carolina Duke game at Cameron Indoor. And so, those are to me a perfect example of super famous brands in the college sports arena. Cameron Indoor is kind of an iconic place for the game. And I couldn't tell you exactly what happened in that game, but I could still, remember, a lot of the scenery around there. So was super fortunate there. So appreciate you guys joining. And now we'll jump into some segments. So we do a top 10, bottom 10. And, normally this is people sharing their salespeople sharing their best and worst kind of, sales experiences. On the other side, health system kind of sharing their, most memorable interactions with sales reps. So you could take it either way. I know you, Zane, have some experience on the other side of the table. We could do that, or feel free to answer it kind of your best or worst healthcare experience as a patient, whichever way you want to go. But why don't you start, Zane?
Yeah, I think my top 10 sales experience working with salesmen or women, or I don't know what the proper term is anymore, vendors in the healthcare space, really was through COVID. And so I think I can start naming names because I actually really appreciate them. But one of them was Genentech, which is a big pharmaceutical, and really appreciated that their sales team, would almost like reach out every other week and not actually trying to sell drugs to us. I'm not even the right person. Like I was very far from pharmacy when I was working for Henry Ford Health System. But what I really appreciate about Genentech and Shelly Skinner, who leads the account, is they were always checking in on us genuinely. How are you doing? What can we do? Can we bridge a connection to, some of our diagnostic services to actually help with COVID response? And then Genentech, which is owned by Roche, has a massive philanthropic arm. And so they're always wondering, hey, is there grants or people we can connect you to get some funding to go on and do, community level testing or vaccination work? And so just really appreciated that they read the room and they weren't trying to pump their product, their products that probably aren't very helpful or needed, but we're still there to support us through that pandemic. So that was fantastic. And then, during that season too, we get a lot of phone calls from, random technology vendors, trying to sell us scheduling solutions for vaccination clinics, when frankly, like that ship had sailed months ago. And so again, just not really, some of these folks just not really paying attention to where we were at in the broader response. But again, the Genentech team, really stands out as people who genuinely cared about us as their client and knew when the appropriate time was to push for their business. And certainly after the pandemic and now, I believe we have a very fruitful relationship with Genentech because it's an appropriate time to do so. But at the time, we're really just there to take care of us where they could. So really appreciated that.
No, that's really interesting because I think for all the busy in your day, right, the fact that you remember, the company, the people involved, I think that's a good, lesson to all salespeople out there, particularly in a uncertain time that, that type of, small little thing can have a serious impact. What about you, Jared?
I pointed 2 times that I was pleasantly surprised by folks who were not anywhere on my radar screen. And it both happened within a few months of each other. Ironically, both within a few months of launching the podcast. So at the time I was still working at a hospital, and one day I got a package and it was from a sales rep at a SaaS company. And all he did was he just sent me a rhyming dictionary. He said, "Hey, I saw on LinkedIn you started this podcast and has a rap. Hope you find this useful sometime." They were not on my radar at all. We ended up getting able to bring them in for a visit and things. I just thought like that was so far out of left field. I didn't know they knew who I was. It was fantastic. And then just a few months later at a conference, I had finished doing a presentation, and somebody, again, not on my radar screen, but worked at a print shop, came up to me and handed me, she said, "Hey, check out the podcast. Hope you don't mind. We grabbed your logo off the internet and made a couple of tumblers." I handed them for me and my co-host at the time, for me and Peter. And she's like, Hope you don't mind. Like, so out of left field. Just, and I think the two lessons that still apply were they were personalized, they're unexpected, but also like they both involved something tangible. Like with everything being so virtual, it's really cool to have that excuse to have like something. I still have both those things. I still have the rhyming dictionary and the tumbler, like sitting in my room.
That's fantastic. And then I guess on the other side, Jared, when now, on that point with everything being digital, are there ways of communication, email or something that just doesn't, resonate as much for you in your day to day?
So I think LinkedIn can be the best. It can also be like so the worst. It can just be the place where I feel like people have found that as an excuse to not do their homework. And it doesn't take much skimming of my profile to know that I put out a lot of content. I'd love for people to engage with my content. You want to know what topics I write about. It doesn't take much. And so for people to even reach out and say, "Hey, what would you like, what topics interest you," or whatever, like it doesn't take much homework, guys, like a couple of minutes reading my profile. And so if anyone wants to be in my world, in my ecosystem, all you have to do is engage with a little bit of my content. So I feel like LinkedIn has just given people a reason to bypass that and feel like they see all the info about me, so that's all they need. Whether they're offering something that is useful to me or not, that goes like a million miles for me.
I love the way you put it, the best and the worst, because I completely agree. That could be a whole nother podcast topic. So switching gears here, and we kind of do a segment on some leaders on the sales side, healthcare side, but this one, the healthcare consumer dream team. So what are maybe 5 influential leaders for each of you that have either shaped the way that you think about healthcare consumerism, or are kind of health system leaders that are in your mind leading the way on this consumer-driven healthcare journey? So maybe we can start with you, Jared, if you have a couple, and then switch over to Zane.
Sure. So the first one that came to mind when you asked that question was Jane Saracen Kahn. Her website is healthpopuli.com. She's a health economist, and I feel like the biggest value to every healthcare leader right now is opening their vision and understanding how consumers make healthcare choices. And that means they're not just choosing between hospital A, hospital B, doctor A, doctor B. They're choosing between all the retailers that are out there now offering bits and pieces. And it's not this just like contiguous journey that we're on, and you're going from this area of the same health system to this other area. It's whatever you need at the time that you need it. So Jane has written several books about it, but she's just one of those. She's a trend weaver. She's at the forefront, and she will tell you what to do there. So I feel like everyone needs her perspective. And then another one I'd put out there is Ann Summers-Hogg. She's a senior research fellow at Clayton Christensen Institute. Spent a lot of years at Atrium Health and their innovation team, and is a champion of Clayton Christensen's theories of disruptive innovation, as well as human-centered design and design thinking, and using that to really focus on what the drivers of health are. So I'll stop there.
Couple that come to mind on my end. The first would be a gentleman by the name of Gerard Van Grinsven, who, go figure, used to be the vice president of food and beverage for the Ritz-Carlton, and he became the CEO of the Cancer Treatment Centers of America. And now today, I'm not exactly sure what his titles are. I believe he's operating as a kind of consultant at large, but he's been leading a group, of folks who are very much interested in hospitality, real estate, sort of the futures of senior living and healthcare, and trying to, I think it looks like, build some new, residential concepts with a healthcare component, but very, very focused on that hospitality level experience. And so I like to follow a lot of his content on LinkedIn and the folks he surrounds himself with, just to continue to stay, sort of grounded in, I guess, my own upbringing in hospitality. The other person that I spend a lot of time listening to is a gentleman by the name of Scott Galloway, who's not actually, a healthcare expert. He's more on the marketing side. So I listen to his podcast and read his books. And what I love about him, Josh, is he spends a lot of time sort of analyzing the big companies like the Netflix, the Googles of the world, the Amazons of the world, talking about their platform strategy, all things that are very relevant in healthcare now. And of course, he makes some predictions around healthcare and rightfully predicted that groups like, or forecasted that groups like Amazon and so on would get into the space. And so I listened to him as someone who's an outsider to our industry in a sense, but can still speak to first principles and make some, I feel like he can see through the fog because he's not caught up in the minutia of our own buzzwords and ridiculousness that happens. And then there's three others who I follow. And, one of the contributions I try to make to our healthcare podcast is being the Canadian on the team and having worked in health systems in Canada. But there is unbelievable digital health talent in Montreal. And I feel like a lot of Americans and your listeners need to know that. And so my good friend, Danina Kapitanovic and Kathy Mala and Luc Sirois, who all essentially work, either at the Ministry of Health level in Quebec or work for the University of Montreal or the Jewish General Hospital. These three, in a lot of ways, are making huge moves in the digital health ecosystem in that region, working inter-institutional, teaching human-centered design. And Canada is very far behind as a relative to the United States. And so I just very much applaud what they're doing. And in Canada, when you start to do some of the things we talk about here in the US, you don't just work with one hospital, you have to work with a whole slew of them and then also work at the policy level. And so I just really appreciate sort of that zoomed out view that they have to take and some of the moves that we're making that I think we can learn a lot about here in the US. And so definitely keep Montreal on your radar for cool stuff happening.
Fantastic. Well, Jared, any other ones that come to mind? It's okay if you don't.
I think that covers that. That's a great cross section. I mean, we have a whole community called the Consumer First Health Group that I feel like I need to mention everyone in there, and there's over 100 people in there. So I feel like
perfect.
Yeah.
We should post the roster.
I was just gonna say we'll make sure and find the link so that because it would be endless, and I would definitely include you two on there for sure. All right, well, perfect. So we do a sports themed MJ versus LeBron debate. So we kind of debate different topics around build versus buy in IT. It's kind of your classic debate that happens around sports and playgrounds over there. And so for you guys, I was interested, and this is a very kind of loaded topic, but consumer versus patient, right? And I think what's interesting about that one is how it's evolved from when you guys first started this journey, and then where do you see it, kind of evolving in the eyes of a lot of the healthcare system and people. So take it wherever you want to go, but that's kind of the consumer versus patient.
You want to get started, Zay?
Yeah, I think in where it started. I remember going to a meeting when I was still working in Canada. And I was very young then, well, still am young, but younger then. And I made the mistake of referring to patients as health consumers. And literally a physician yelled at me and said, "What the heck? Why are you speaking this way?" And so I'm excited to see that, at least with the stakeholders I work with now, this whole lingo about patients, more broadly being health consumers is finally catching on. And I think people are getting the notion and understanding what we mean by that. And we're not trying to discredit physicians or discredit sort of the clinical identity and needs of patients. And I think what's driving that, which makes me really happy, is a lot of these disruptors who are jumping into the space, Amazon, Google, CVS, you name it, who truly come at this with more of a consumer, typical customer perspective, are finally starting to make legacy health system leaders realize that they need to get on this game as well and start thinking like a normal for-profit publicly traded company would think about servicing their customer base. And so that's exciting, and I do think it's going to continue. So we'll see where that goes, but curious what you think, Jared.
Yeah, well, it's a very real debate. I mean, I'm glad you asked us this because it's preventing us from making more progress. We're getting stuck in these definitions, and it's limiting our ability to have a real conversation about points that are going to get us to a better place quicker. And what I mean by that is I hear this all the time. There are providers who, rightfully so, both terms have come from good places, I feel like, the term consumer and the term patient. The term patient connotes the dignity of the care that's happening from a clinician in a care setting. There is a dignity to that. There's a lot of training. There's a lot of science behind it. There is no disrespect to that in using the word consumer. And yet that's what happens a lot. The common concern is, how dare you refer to them as a consumer? Like to Zane's point, providers are most commonly the ones who are saying, how dare you refer to them that way? Like, they're my patient. I care for them. I'm treating them. And the goal in my mind of using the word consumer is to not take away from that at all. It's actually to build upon that and actually help us do that part even better. But the word consumer in my mind is the one I focus on to use, because people in a health system or a hospital setting, they need to focus on the time that somebody's actively being seen by a clinician. So that's the time that you're a patient. For most people, and I always want to have that caveat too. There are millions of patients who are chronically ill and are truly continually patients and encountering the healthcare system on a daily basis. So not taking away from that at all. There's this definition of this understanding that just needs to happen of all the healthcare choices that happen when you are not being actively seen by a healthcare professional. And those are the parts that the business systems underlying the healthcare system right now were not equipped to deal with. They weren't set up to make things easy. They weren't set up to make things at a reasonable cost. That's why we have to have insurance and health plans in there taking on risk, because the business systems underlying it weren't set up for that. They weren't set up. It was just like, hey, you're in the system. We're going to tell you who the doctor is. We're going to tell you what you need to have done, and you're going to pay that bill. And that's all it was. So now, as other options have emerged, the other place people get stuck in that debate is thinking, well, I don't want to call them consumer because they're not usually the person who pays for it. The consumer is really the person who pays for it. So it's the health plan or it's the government. And that also limits our ability to have a true discussion here, because yes, those parts are important, but those parts are covered in other discussions. The conversation that's the most useful for us, for consumers of healthcare right now, which is all of us, is to recognize that the system is not very easy, and the business systems that are underlying it are making it that way. So what can we do to make it easier? What steps can we take? How can we partner together? Can digital health, can virtual primary care startups and health systems all coexist? For the love, like let's do that. So that's kind of where it gets into the weeds, and let's not get lost in one or the other. We are all consumers all the time. We're patients some of the time.
That's actually a really good way to put it.
I was going to say, well said, and that's a perfect, segue for, what are those predictions? I know that you guys, look a lot at different companies or different trends. I'm so interested in kind of, each of you's top three, either, healthcare predictions for what the next, kind of 5 years or 1 or 2 years are going to look like, or, companies that might be involved in helping change that. So why don't we start with you, Zane?
Ooh. Let me look into my crystal ball. I think I said this on our prediction episode, which I will tell my own horn, have the habit of being right, sort of.
He does.
One thing, Jared can speak for this, one thing, and I'll say it here, we've already said it, is, I think the future of consumer-driven healthcare is really just going to be like more community-focused and aligned healthcare. And so if you zoom out and like realize where we are in this country around, budgets and where the government is broke again, we just hit our debt ceiling, all that, putting all that together, I really do think that potentially legacy health systems have gone too far when we think about these massive now conglomerates of health systems, mergers. We know what they're trying to do is get scale and decrease their cost. But what has happened, at least the public feels like what has happened is it's come at the cost of those health systems being more actually rooted and connected in their community, similar to what you would see in Canada. And not to mention, many of these health systems have preferential status with the government. They don't pay taxes, and in effect, the rest of us are subsidizing them. And then when you pile on, the helicopter cash dumps they've received through COVID, which, certainly they needed. I think that whole value equation is finally coming before the eyes of Joe Public and realizing that this isn't working. And so I do think, maybe not tomorrow or in 2 years, but like at some point, I think health system leaders are really going to be held to account for where is this money going and what are you doing with it? And then what types of services are actually delivering in this community such that you feel like you shouldn't be paying taxes. And so I think that whole, that whole system is going to be looked at. And I wouldn't be surprised if some communities, will start to advocate for some of these big hospital systems to be dismantled, and will sacrifice scale and maybe a few points of efficiency to just have these things actually serve the geographic community as opposed to just big, broad insurance populations. So that's one thing that I'm looking for. And there's already been some signals in the marketplace. You see, I think it was Forbes and some of the big articles that have gone out, highly criticizing executive pay. A few reports have gone out showing, the gap in community benefit reporting versus what the hospital didn't pay in taxes. And so I think that's something we don't often talk about in the digital health space because it's not exactly related to digital health, but I think it's going to be a big trend in the background that we need to be watching. And so any tools and services that can help health systems demonstrate that they're here for this community and actually helping people beyond just delivering clinical care, I think will be very relevant to boards and executives to show that they're in that game. And so that would be one random prediction that I would put out into the universe.
Nice. I guess we just riff back and forth, right, Zane? I think the investments from retail companies will continue to go up. Those aren't going away anytime soon. So you look at the escalation too. So Amazon bought One Medical for $4 billion. CVS bought Signify Health for $8 billion. VillageMD bought Summit Health for $9 billion. And now CVS bought Oak Street, or is buying Oak Street, or is planning to.
Is that for sure?
At least they made the bid, apparently, for Oak Street for $10 billion. So those aren't going away. And those aren't just, hey, we have a slight interest in these things. No, CVS wants to have an entire primary care infrastructure that can scale nationwide. That's why they're doing this. Signify Health also at the same time, at-home care. That could be an actual continuum of care that all happens outside the hospital. And do they need to get into acute care? No, they really don't. I don't think that's part of their value chain. So retail investments are going to keep going up. What does that mean? At some point, that affects the growth engine for health systems that have put all those chips into the middle of the table of primary care. That's what gets you in to see their specialists who are on their plan. So that's just going to have an effect there. And then the second one for me is what that leads to is, and there are health systems, we're generalizing a lot, we're painting with a really broad brush. There's some really innovative health systems out there right now that are doing amazing things, that are putting together a more digital, cohesive, connected patient experience. And though it's truly going to become a competitive advantage to be able to say, look, we removed some friction from the way that you encounter a doctor here. We made it easier for you to pay your bill, to understand your bill, to contact us. We're not going to charge you to message us in my chart, or whatever the thing is. we're compensating that or whatever it is, but experience is going to become a competitive advantage. Those have been buzzwords for a little while, but you're going to see innovators and early adopters at least truly invest in that and make a difference. I guess are we going
Fantastic.
three apiece or I guess that's quite a few already.
I don't know, Zane. You got any more? Because I appreciate those, Jared, and I think that what you hit was spot on.
I don't know if I have anything more to add beyond, just opining on Jared's comment around experience becoming the competitive advantage. That's certainly what's happening now. And then probably a few years down the road, I would describe it as like relationship will be the competitive advantage. And so how do health systems, similar to like an Amazon Prime relationship, keep people constantly engaged in their services, or what other services might they need to procure so that there's a daily reason why I would engage with a healthcare provider. I think that's going to be an opportunity. A great example, I think it hit the news not too long ago, but a health system like Multicare, and they created a product called Indigo, which is an urgent care, similar to almost like a One Medical-ish. And, they've partnered with 98.6 to do some of that technology work. So again, great example of like health systems leading the pack, working with disruptors to really make, those highly personalized and convenient experiences like Jared describes.
Yeah, I couldn't agree more, because I think I've been in the fortunate on the other side of the seat, but have worked,
Sure.
And at Bioformis and now with Tendo with some really innovative, system leaders, service line leaders, executive leadership, and they're certainly there. And all of what you just described, Jared, to me in my sales mind is how are we going to quantify ROI, right? And it is rapidly changing. And I think both on the other side, organizations internally, but also too, vendors are really going to have to be dynamic and like truly tracking, some of those both in real time. I think it used to be a legacy spreadsheet, and it could go on, budget or cap table or things like that. But now it is truly going to be working, not only with your own internal system, but other vendors to, to track almost in real time, whatever those ROI metrics are going to be for some of what you guys are talking about. So super interesting. All right. Well, a couple more. One of the key purposes that I started the podcast was to help. I had a unique entry point into this whole digital health world. Never would have thought that I would be sitting here and even in the digital health world. So this is kind of our rookie healthcare leader advice, right? So the purpose of this is, maybe, and I know, Zane, you had a unique entry into healthcare, but when you're looking at what this future of healthcare is going to look like, what is some advice you have to people that are either in school now or looking to kind of, be in your shoes and be a healthcare leader or be a part of, some of this change?
Sure. Well, a couple things. I would recommend everyone start very small. I still thank and credit, my career to starting in a very, very small hospital in rural Canada. It was 58 funded beds on a good day, like dollhouse size hospital. And in that hospital, I was able to learn so much, because when you have a small administrative and leadership team, everyone has to do 3 jobs. When I came to Henry Ford Health System and walked around the corporate office, I realized there were entire divisions of corporate people that were doing the responsibilities that I had under one role. And so I think, don't get caught up in trying to go to Cleveland Clinic or Mayo Clinic in the case that you want to be in hospital leadership and all these big brands and get lost in the mix. Start small. If you can find a critical access hospital or a tiny community hospital, get in there, because you'll learn all of it. And the good news is, whether it's a massive hospital or a tiny one, they're all the same, but it's only within a tiny one that you can really figure out what all the pieces are, so that you know what you're talking about when you go to a bigger place and understand bed flow or staffing implications, or what is it that diagnostic imaging actually does. And so I think starting small and not getting caught up, in these big healthcare brands is probably a good idea. The other thing I'd say too is, especially, and I see this, I don't know if it's just a Gen Z issue, but I see a lot of young leaders like very focused and adamant about, getting FaceTime and networking with people with very senior and fancy titles, which makes sense, but don't discount the wisdom that comes from people that are just middle management, or your peers. And like, when I think about the things that I really learned, it came from those folks. And frankly, it came from like floor nurses, and in Canada, we call them unit clerks. So administrators who know a little bit about healthcare, who are actually helping to orchestrate, every department of the hospital. And so I learned so much from those folks too. And so again, I guess don't get so caught up on pedigree and flash. You can learn a lot from the small, the unbranded, and, the people who may not necessarily be super high on the org chart. So that would be my advice if you're just starting out.
Nice. I like that. I would just add, especially for someone who's coming up through the sales ranks or marketing ranks, to focus on making your brand relevant. Don't assume that because you put something out there organically on social or in an email, or you have to learn the basic rules of engagement for each of those platforms and how you're engaging with people. But don't assume that because you put it out there that it's making your brand relevant. If you focus on that, you double down on that, then you're opening doors without even realizing it, and you're reducing a sales cycle. You're getting rid of a lot of the MQLs and SQLs, the qualified leads that lead to nowhere, that you don't end up winning. You can bypass a lot of that by putting some value out there into the world. That's where content marketing can really accelerate a sales cycle. Is if you put good content out there, you're impacting and influencing those who are influencing your buyer at one point or another. So I would definitely double down on that. I wish I'd learned that earlier, and I wish there's still places I want to get to in a better place with that. And then from a personal development standpoint, kind of like what Zane was saying, I'd also say get informed about adjacent areas to the place where you are. So if you're at a health system, awesome. Learn everything about it, but then learn what retail brands are doing. What's Best Buy doing? What's Dollar General at least claiming to want to do? Some of them are doing more than others. But what's MedTech doing? What's that health plan doing? Do you understand those? Learn those adjacent areas, because they all connect. And also, especially follow the money. Learn the economic engine for each of those types of businesses, and you'll arm yourself with more information than 99% of everyone else around you, and that'll show through.
Yeah, I think to Jared's point, I would like to remind people that the business of healthcare has not really changed. So sure, there's all these new brands that are getting involved, and these disruptors jumping in, but they're still operating within the same economic framework to an extent that legacy healthcare providers are. Right? If they're trying to sell to Medicare Advantage patients, it's the same payment as a traditional health system that's selling the same market. And so learning those fundamentals can then help you see through the press releases and say, okay, what is this company really doing? What might be their struggles? And the good chance there are going to be similar struggles that health systems face too. And so I think, again, going back to starting small, where you can actually learn healthcare fundamentals, and then you can scale it up and go, work for someone fun or someone that's in the news all the time.
No, I love the blend of both y'all's experience, because, I too, very similar, I always point to the most fortunate part of my medical sales career was, not this or that. It was, sitting in a rural North Carolina primary care office, or being fortunate enough, to help with a patient, an RPM in rural Georgia, right? Which I was calling Houston instead of Houston, Georgia, right? These are fortunate. These are fortunate experiences that I had, but I saw people kind of trying to come from outside of healthcare and on a technology side and sell into healthcare. And it wasn't just sales reps. I mean, these were leadership and people, try to say, hey, we should do this. And then in my mind, I always closed my eyes and thought about, that doctor's office and say, well, we can't do this, and we must do this, but here's why, right? So I was super fortunate about that. But, I'm also, big believer in evolving. So, although I can remember a time where I literally cold called and set up lunch and went and brought Panera catered lunch, and that was a cold call, I'm not, one to say, you got to earn your stripes and do that type of cold call. I love leveraging technology. I love what you said, Jared, of, building the brand, getting the right people. And, there aren't going to be people that have the experience to just, show up in a doctor's office and say, hey, can I, observe what you do? But I think in absence of that, you really do have to, if you want to, walk a mile in their shoes, truly get in and then get ingrained with some of those people. So I love that advice. All right. Well, wrapping up, the last segment, normally it's just, quick sales plug or plug. So we'll, about a minute each, what do you have, going on, and where can people kind of, find you or support, whatever you're doing? Why don't you start, Jared?
Oh, thanks for asking, Josh. I would say check out this podcast channel we're trying. It's called Shift Forward Health. So Healthcare Rap is the main show on there. It's a weekly show there. But Shift Forward Health was meant to be one channel. It's kind of like HBO Max, kind of, in that you subscribe to one thing and you get a whole bunch of shows. So what we were trying to do is eliminate the way that you have to go and find each show individually and subscribe to it individually. You subscribe to this one channel on any podcasting platform, and you get 3 to 4 shows each week from different hosts. So you're getting this much broader view of the industry. You're hearing from Zane and me, but you're also hearing from our hosts who are based internationally and those who come from different sides of the industry and represent a much bigger amount of the industry than Zane and I could on our own. So that's the plan. There's 8 shows on there right now. We're adding a couple more here in the next few weeks. I mean, it's been a lot of fun to build that. It's been out there for about a year now. And it's just the goal is that's the channel for change makers. If you're interested in helping change that status quo of the healthcare system, then it's a place ideally to have a lot of types of different content there. So I definitely say, and it's all for free. I mean, that's the whole point. So I definitely invite people to do that. And yeah, thanks for asking.
Fantastic. Yeah, fantastic. And I can attest to it. If you're interested in consumer-driven healthcare or just healthcare and digital health on the pulse. And then I'll translate for Jared. Basically, what he's saying is that, healthcare rap is the Game of Thrones there, right? Healthcare. No, it's a really awesome resource, and it's been super helpful to me. So appreciate you sharing, Jared. What about you, Zane? Anything going on?
I think the thing that I would plug, so my day job, I work with Avia Health Innovation. I help lead our consumerism team. And so if there's any solution companies out there trying to sell into health systems or health systems themselves who are looking for support around their digital health strategy, that's something that we do day in and day out. And work with our hospital system members to help them understand the landscape of technology out there. And so definitely reach out. I'm happy to have a conversation and seeing how the Avia community and network can best serve you all.
Fantastic. And I wrote it down while you were talking, saying this is a bonus question. Any Ritz-Carlton in the world, where would you go, and which Ritz-Carlton would you want to visit?
I would probably go to the one. So I've never actually been to one. It's on my goals list to go to. It's just very expensive, but I would probably go to one in the mountains. So I know there's one, I think, in Vail. I like mountains. I like skiing. So I'd probably, if I was going to spend the money, I'd spend it there and ski. And then the Four Seasons is also very interesting to me. It's a Canadian company, by the way, and maybe in a separate show, I could talk about the story of how I got invited through an intern that I met at Henry Ford Hospital to come and tour their corporate headquarters in Toronto. But that's a separate story. But on the Four Seasons side, I probably can go and visit like one of their flagship properties in Toronto, which actually isn't too far from here. And so those would be my 2 choices.
Fantastic. Well, guys, I appreciate the support and jumping on the podcast. And Zane went ahead and threw a cliffhanger, so we'll have to get together and do this some other time. But thanks, Absolutely. Jared. Thanks, Zane, and looking forward to help educating and following you guys on the consumer health journey.
Thanks so much.
Thanks for having us.
Thank you for listening to another episode of Inside the Digital Health and Sales Locker Room. I appreciate your support. If you're interested, make sure to follow, subscribe on Apple, Spotify, or write on Substack. And make sure, if you're interested, to subscribe and share digitalhealthlockerroom.substack.com for some more podcast and weekly newsletter updates on all topics around digital health and sales.